Hi, Jean. Surprised I'm the first one.
How you doing?
Pretty good. How about you?
Good.
Good.
Hi, Christine. I think I see your number.
Oh, hi. How are you?
Good. How you doing?
Good.
Do you mind if I change your, if I put your name next to your phone number so people know it's you?
Sure. Oh, sure. Yep.
Okay, thanks.
Hey, Jean.
Hello?
Hi, this is Sherry. I have to pick my daughter up, but I'm on the phone too.
Oh, okay, thank you. Do you want me to do the same? Put your name on there?
Yes, please.
Okay, you got it.
How we doing?
Hey, Kevin.
Hey, Shrine. Hey, Rick.
Hey, hi everyone, Jean, Sean, Jackie, Christine.
I'm going to go ahead and hit the record button.
Recording in progress.
Got it. I love
And Carrie asked me to let everyone know that she has something's come up. She's going to attempt to make it, but she's dealing with a personal matter. So
Okay.
she'll join us at some point.
And Paula won't be attending as well. She sent me an email that she won't be able to make it.
Oh,
That's a problem.
yeah, that is a problem. We don't have a quorum.
I don't think Rick can elevate either one of us without a quorum.
Oh,
But are we voting on anything?
well, well, we were gonna vote on the minutes, which obviously could wait until January. And then I think I mean, it's a fairly short agenda to begin with. And then it was just informational around the coalition or the health department update. So let me ask our parliamentarian, Kevin.
I'm thinking right now, I was just gonna refer to Jean. Jean, if technically if Paula or Kerry could quickly jump on to get the meeting started for a quorum, then elevate either myself or Jerry, could she then jump off, or does the quorum of voting members need to stay a quorum in order to do the business? You know where I'm going with this?
Well, I guess, yeah.
I don't know the answer to that question.
The question in my mind is, can the chair elevate you as a voting member?
Sure, in a meeting of which you need a quorum.
That's the kicker.
That's the kicker. So that's what I'm saying. If one of them, either Kerry or Paula, could jump on real quick, if they only have 5 minutes, start the meeting with a quorum, elevate myself or Jerry. You can't elevate both of us, Rick, because you can't be two against one. I know that. You can't have more elevated than actual voting members in a meeting, but could you then theoretically let them, either one of them, jump back off to do whatever they need to do and still run the meeting with just the two, the one member and the one associate? That's my question. Can you actually do that? Would you have to maintain a quorum of voting members the entire time? That's my question. And do we have town council on speed dial for an answer?
Well, I think that, since, I don't know, I mean, since most of this is informational, I mean, one simple solution would just be to defer the approval of the minutes until January.
Yep.
And whether, in terms of the other two updates, I don't know, can we do those verbally briefly now, or could, a day send an update? I mean, we already have the nursing report on COVID from Shuang and Christine. There may be some additional things, but these could all be updated to the board members via email, and just defer on the meeting tonight. That would be another option.
So technically, if none of us discussed anything from an informational standpoint, if it was just information given one way, I don't think we violate open meeting laws, correct, Gene? If we don't deliberate, it's deliberation that violates an open meeting law.
Well, you can't call a meeting to order because you don't have a quorum.
No, Rick's just talking about, hey, I was going to give a little piece on the coalition. There's some more information that was going to be shared today as far as the nursing report. Can those reports just be given and nobody say a thing about it?
No.
See, I always thought it was deliberation that violated the open meeting, not the information.
No, I think you are on thin ice.
It's thin, a little gray area. I'll admit it's a little gray area. I'll definitely get that one.
I don't think you can even.
I definitely know town council's answer to that question. He doesn't like thin ice. He doesn't like gray areas. He tends to say no.
What I was just checking again on the email that I got from Kerry, and she said that she thought she might be a few minutes late. So my suggestion is to hang tight. I'll email her again and see if she is like 7:15, 7:30. At which point you would have a quorum and you could act accordingly. I also just emailed town council. So hang tight. Let me
Okay.
see if I can get some more detail. You guys are making me work on my last night.
Wait, what? This is your last night?
My last night.
Last time? Good for you.
I found the bylaw. It's not terribly descriptive. It just says if any regular member is absent from a meeting, disqualified from acting, or otherwise unable to deliberate on a particular matter that comes before a board or committee, the chair of such board or committee may designate one or more associate members to deliberate and vote on any matter before the board or committee. If more than one associate member is available to fill a temporary vacancy, the chair shall designate that associate member having the greatest tenure on the board or committee, provided, however, that any associate member so designated shall be entitled to continue to participate in the matter as necessary and to remain qualified to vote thereon. So it doesn't really say, you know, if you need more than just the chair to promote an associate.
So it doesn't reference anything about during a meeting? Is there any reference to during a meeting and any of that? Sorry, I was listening for something else and I didn't pay attention.
Oh, sorry. Just if a regular member is absent from a meeting, disqualified or otherwise unable to deliberate, that comes before the board or committee, the chair may designate one or more associate members to deliberate and vote on any matter before the board or committee. It only says the chair. But it's really vague.
Yeah, I mean, I remember when this was put in play, I thought you had to have a quorum still. I could be wrong. To start the meeting. That's why I was looking for that verbiage, if it says in a meeting.
Yeah, I don't see anything that clear, unfortunately.
Well, I'm gonna have to send this one back to the committee to clean this one up a little bit, Gene. Well, in lieu of that, how's everyone's Thanksgiving?
I do feel that, you know, given that we don't have any presenters and we don't have any, you know, burning issues that need to be decided. And I'd rather not walk on thin ice over a light agenda. You know, I think if it was a heavier agenda, maybe we would, you know, really try to grab people or do what we needed to do. But
hang on, I'm getting some technical assistance as we speak.
Great.
Okay, hang tight. We get the answer coming momentarily. Okay. Thank you all for being so patient. I have just confirmed that the chair can elevate an associate member as
Excellent.
a voting member for the meeting.
Oh, okay, great.
As long as you have 2 full members that can vote per the chair, you have a quorum.
Okay.
So
Well,
you don't need a quorum to elevate.
to do that.
Nope.
Okay,
Good.
excellent.
Okay. So I can't call a meeting to order until I elevate. So I would like to elevate Kevin as the more senior associate member as a full member for the purposes of this meeting. And I'd like to call the meeting to order. In terms of the agenda tonight, as I said, it's fairly brief. We want to review and approve the minutes from the last 2 meetings in November, get a coalition update from Kevin, hear the usual health department monthly report. It's no longer a health division, but a health department. And if there's any public comment, we can engage with that and then wrap up. So on that note, any questions or suggestions or changes to either the minutes of November 4th, which was our last regular meeting, or November 18th, which was the meeting which we designated a day as health director?
I have none.
Look good to you, look good to me. Then I would entertain a motion to approve the minutes for both November 4th and 18th.
So moved.
Okay, second, roll call, Kevin?
Aye.
Rick, aye. So those minutes are approved. All right, Kevin, did you have any updates from the coalition?
I do actually. They had a really good meeting at their, when was it? It's back on the 17th of November. A couple of things. There's always a lot that goes into it. I'm going to share something, a link as well in the comments here. A couple of big things. Obviously, the last meeting that Erica presented to us in regards to their survey, risk survey they got back, had a lot of troubling trends in it, to say the least. So I was really kind of worried about seeing those trends. We probably all kind of knew with the pandemic that it would trend in a more negative way, but they were really, when I went through it a lot more, it was pretty stark, the difference between, I think, the previous one that they were able to do and this one. So Erica and her staff have been really hard at work. They really delved right into the schools and started working with the kids in a couple of different programs. One they call SBIRT, and I got to find where I put what that stands for. There's way too many of these things lying around, which is the Screening, Brief Intervention, and Referral to Treatment Program. So what they do is they pulse kids when they have kind of flex time in school. They pull them out of that flex time and they interview them and kind of try to get out from them, things that are problematic going on in their lives, things in regards to addiction and drug or alcohol use, and it's a kind of an early intervention program that they run, which is really a pretty big program. You have to go and get certified for it. There's all sorts of certification that you have to get that they've been through, and they've done that. So that's one of the interventions that they've triggered. They've been doing this for a while too. Now this is not new, but I think they're probably going to be stepping up their efforts in that regard. The second one, which is, if I can find this link, I'm going to share it with you. What did I do with it? There we go. One sec. I'm going to put it down here in the chat. Get it to paste. So this is a program called HOPE. I don't know if anyone's ever heard of it. healthy outcomes from positive experiences is what it stands for. And this is another tool that they're going to be utilizing at the high school. I believe it's just the high school level. I'm not sure if at the middle school level as well, but definitely at the high school level. And if you open this link and go through it, and she gave a presentation to the coalition at the last meeting, it's really just a phenomenal program. And it identifies a lot of different data points that they can look to try to intervene earlier rather than later with these kids. So a lot of it is experiences that they've had outside of school, negative experiences. If I can find that acronym, what they were referring to on their site. But this is really, when she went through it, I was pretty impressed. This is an excellent practice to put in place. And again, you got to go through training for this as well, which they've done. And so this is something that they're going to be utilizing moving forward. Like I said, I definitely know at the high school level, I don't have it in my notes if it was going to be both high school and middle school, because I know both assessments were done at both schools. But it was really pretty impressive to see how they go about making sure that they're having healthy outcomes from positive experiences. Again, that term hope. And it's, I can't find, now I might have to, one sec. I was looking for something on their site. Let's see if they had it for me. Here we go, that's what I was looking for. Let's see if they tell me what this, everything is, if they give me what it's for. I can tell you, sorry everybody. I should have looked at this earlier. Now, I will, well, anyway, go on the link. If you go through this, there's ways that they go about, and they call it ACEs. I forget what it stands for. I was trying to find it on their site. It's ways that they can identify having these negative experiences in their life, and depending on the amount and severity, kind of changes the way they go about helping the individual. It was a really good presentation that Eric put up. I should have probably had her give it to me. Maybe I'll get it for the next meeting so I can bring it over here and put it up on the screen. But it's great to see that after such a tough 2 years, and the mental health of these kids certainly has taken a hit from that survey. Definitely shows that. It's nice to see that Erica and her team really jumped in and kind of going after this very aggressively and with really good tools at their disposal. It's an absolute asset to have them, as part of the town. I know they were just a grant before, but having them now as part of the town itself is a real asset for us, and especially Erica. She has been great to work with. So that's there was a lot that went of updates, but those were the two big ones I found that had a lot of crossover to this board. I thought you might want information on.
So thank you, Kevin. Can I ask you two questions? One is, on the first program you mentioned, and when they pull people out, students out when they have flex time, is that a group session, or is that one-on-one interviews? Do you know?
I think it's, I don't think they're one-on-one in terms of they're not having like 5 or 6 kids come in at once. Right, it's one they're pulling one kid out. I think the last time, the update that she had given us, they had for the week, I think it was the actually week prior to that meeting.
Yeah.
So I think the week of the 10th, they had taken 10 kids out at that flex time.
Okay.
And
do they are both of these programs done just by the 2 staff in the coalition, or do they extend or do the training and certify people in the school system to be able to do this, or is it limited to just the 2 people, Erica and the coordinator in the coalition?
No, and that's a good point, and thanks for bringing it up. It's definitely all the team leadership in general. Mary Giuliani, who's the head nurse, is involved in this. see, they also have Lynn Dunn, Nina Conway, the SROs, which is the officers that are there, Tom Zaya. I don't think they're all in the room, but they're all integrated in this process.
Integrated in the program.
Yeah, they're all working together. I don't know. It didn't really say who was in the room, but they're all integrated and work together to kind of get this program going.
Well, it's
So
good to
real
hear
collaborative.
that they are addressing some of those issues from the survey, because those were disturbing.
Yeah, I was really glad to hear that. It was an excellent update from Erica for the last meeting.
Any other comments or questions before we move on for Kevin? Okay, thank you. That's good. So I guess I'll turn it over to Aday in terms of the monthly report.
Good evening, members of the board and the general public. I am here to give a general update on what the department is working on. I will be talking about permit renewal updates, health inspector vacancy notification updates, FY23 budget updates, tobacco compliance violation updates, environmental health updates, and body art apprentice permit updates. It's a little bit different from how it's structured on the agenda, but they're all under updates for the Board of Health. Currently, the annual permit renewal process is ongoing. The process has been a little bit delayed due to multiple changes within the department, as well as the transitioning from paper applications to an online permitting system. The annual permits are on a calendar year schedule, and we are working swiftly and diligently to get those permits renewed before the end of the calendar year. Kim and Don, they've been very good at helping out. So hopefully we should get those permits renewed before the end of the year. Vacancy notification update. We have the full-time health inspector position that I've been working on with Sean. We put the finishing touches earlier today, and I'm hoping that it would probably get posted later today or earlier in the week. Pretty much, I went through the previous vacancy notification, and I made some adjustments to reflect new changes that may be beneficial to the health department. So fingers crossed, this should get posted probably later today or early next week. In terms of FY23 budget update, I've put together and submitted a proposed level 1 FY23 health division budget. Due to the time constraint, I couldn't share the document with the board prior to submission. I would probably send it to you, the board members, later on tonight or tomorrow. So pretty much, we are planning on moving to the public safety building July 1st, 2023. Based on my assessment so far, assessment of the department and the future needs of the department and program improvement requests, I requested a funding for a full-time admin staff. Once we leave the town hall, we won't have Kim or Don, to help us out anymore. We won't even have Jackie to help out anymore. So we need our own full-time admin staff. I'm not sure if any of you has been to the space. It's really tiny. I don't see how we will be able to move all the file cabinets that contains all the health department records to that building. There's no space for the cabinets. So we're gonna need to do something with the information stored in the cabinets. So what I'm proposing is to digitize those documents. We hire a contract archivist to come in, scan those documents, organize the documents, put them on OpenGov, so we can leave the cabinets behind, but still take the information with us to the new building. The information will be accessed via phones, tablets, computers. So we don't need to take all those cabinets with us because there's nowhere to store those cabinets. Let's see. So I requested funding for digitization of the health department documents. I also requested funding for COLA, cost of living adjustments, and salary adjustments. So estimated amount to cover those items equals $61,209. I'm hoping that we wouldn't have a problem having it or getting it approved, because everything we've asked for, all those things are needed. We need a full-time staff. We need no space to put those cabinets, so we need to digitize those documents. Also, like when people request public records, we can just go on the computer, type in the address, and everything comes up. So nobody, the admin staff doesn't need to run to the file cabinets or the drawers and start getting information here and there. Just type in the address, print, or you can even just mail it out, or send an email to whoever is requested the documents. So I think it will be a great investment in the department. I think it makes things easy for us and for everybody. Next is tobacco compliance violation update at Square Liquors, 18 High Street. So pretty much Square Liquors sold a tobacco product to a person under the age of 21. The next step will be to issue a cease and desist order, which I will be doing next week. Also, they will get a fine of $1,000. And because it's their first violation within 3 years, that triggers a suspension of 1 to 30 days. So the number of days will be determined by the Board of Health. So the way this works is, once I send the cease and desist letter and I assess the fine, I would also send them a suspension notification letter requesting their presence at the next Board of Health meeting for a hearing for a possible suspension of their license. So we're looking at January's meeting. They will be present. And they would have to tell us why they think we shouldn't suspend their license. And if they make a good, valid point, then it will be up to the Board of Health to either waive or suspend their license for, 1 to 30 days. So everything will be done by the Board of Health.
And just to be clear, this is suspending their a license to sell tobacco products.
Correct.
And so it could be, we could waive it, or it could be 1 or 2 days, or up to 2 days, right?
Correct. It's their first violation within a 3-year period. So it could be waived, or we could give them 1 day, 2, 3, between 1 and 30 days. So.
Okay. Do they have the ability to go back to the state, and if, let's say it was even just a day, go back to the state and ask them to remove that? I know with our liquor license, we have similar procedure where the individual can actually go back to the state and say, well, they gave me too many days, it's too harsh.
I believe they would have to go to court for that. And in most cases, the decision will be upheld. But I mean, since it's their first offense, we have the jurisdiction to waive or give them 1 day. It just depends, but it's their first offense. So I know that when we issue 21D tickets for trash, for the first offense, it's usually a warning, $0, just a warning. So it just depends on the board, what the board decides to do.
And they're already being, you said they're definitely being fined 1,000. Is that correct? That's
Absolutely.
not-
Yes.
Okay,
Yes.
which is pretty penal to begin with. Okay.
Yes. So that will be the protocol. So we should expect them at the meeting in January. All right. Environmental health updates. In the month of November, we conducted 6 complaint inspections. We conducted 10 food inspections, 3 pre-operational food inspections, 3 re-inspections, 1 food plan review, and 2 site visits. And last but not the least, the body art apprentice permit update. So I think it was earlier in the week, we had an inquiry from one of the body art establishments in town. The establishment is looking to hire and license a body art apprentice. Unfortunately, the town does not have a body art apprenticeship program. So we don't have one for the town of Reading. Most towns do have the apprenticeship program. I looked into our regulations to try to see if there is, something in there that applies to, body apprenticeship programs, but there's nothing. So I'm looking to work on that in the coming weeks. It will require an amendment to our current body art regulations, and the owner of the establishment called and said, "Hey, I already hired this person, but I don't want them working illegally, without having a permit from the Board of Health." And I pretty much told him that I will get back with him, but at this point, I'm gonna have to tell him, we don't have that program at this point, so you can't move forward, or you can wait for a little bit and let me put the program together, and then we'll go from there. So it just depends. But I'm just letting you guys know that in the coming weeks, I will be working on that, and hopefully before the end of the month, we should be able to have a program put in place. And that concludes my update.
Thank you, Danny. This apprenticeship program for body arts, towns actually have such a program town by town by town. It sounds pretty, I don't know what a program consists of, but it sounds like a lot of administrative work to do that for one apprentice, doesn't it?
Not really. It's just there's certain set of requirements that apply to them, more stringent requirements, and all we have to do is amend our regulation to include those requirements, and set it up in the system so we can print out a permit for it, and we should be all set.
Okay. Well, maybe we'll have more discussion, educational board members next month on that when that comes up. Were we going to get updates from Shuang or Christine as well?
Yes.
Yes, Christine, would you like to go first?
Sure. Yep.
Okay.
Good evening. So the following is a nursing report for the town of Reading over the past 14 days, November 18th to today, 12/2/2021. Maven data is provided via Maven reporting and is subject to change. The total case count is 2,658. Our active cases are 146. 40 additional cases came in this afternoon after this report was submitted. So I will update the data. Deaths remain at 50. Transferred remain at 16. And recovered currently states 2,446, but again, I can update the active and recovered list. That would make the total 2,701 and recovered 2,000. Let me just see, do the math here. Well, anyways, I will update both the active and the recovered list. But again, I do want to stress that 43 additional cases came in from noontime to about 6 p.m. this evening. With regards to COVID in the schools, this is just a breakdown of the number of active cases currently, and the dates remain from over the past 2 weeks. Reading Memorial High School, there are 4 students, no staff. Coolidge School, which is a middle school, is students 3, 0 staff. Parker is a middle school, students 1, staff 0. Eaton's student 1, staff 0. And the remainder of these schools are elementary. Barrow, students 2, staff 0. Killam, students 2, staff 0. Birch Meadow, students 4, staff 0. Woods End, no students, no staff. And Rice, which is preschool, students 1, staff 0. Vaccination rates at the school, at the high school level, 85% are vaccinated. Middle school, 63%. That includes Coolidge and Parker. Elementary, Eaton, 5%. Barrows, 5%. Killam, 3%. Birch Meadow, 6%. Woods End, 7%. And obviously at the preschool level, it's at 0. I did have a discussion, a weekly meeting with Mary Juliana, and they held their first COVID clinic on November 3rd for the younger kids, 3 to 11, to be vaccinated. There was not a very large turnout, maybe 20, 23. However, she has a lot registered to attend tomorrow's clinic, approximately 175. So hopefully we will see some of the younger children at school receive their first dose. There'll also be second doses given at tomorrow's clinic as well. I know that the school nurses are working diligently. They're continuing the pooled testing, which is really detecting a lot of the positive cases. The school nurses, in collaboration with the public health nurses, are able to intervene before a lot of these cases even hit the Department of Public Health lab reporting. So we're able to issue guidance and keep the spread or the transmission rates within the school at a pretty low level. Although there is some in-school transmission, again, I think because of the testing, in the collaboration where we are able to intervene, and the transmission rates are quite low. I would like to just add one thing in that I didn't include in the report with regards to Austin Prep. And I know that Shuang and I have been in discussions with the school nurse over there. Right now, they do have a cluster. It is a baseball that practices indoors, and there are 13 positive cases. Only 1 is a Reading resident. Other clusters in the community, there were 4. 1 just was able to reopen, but there are 3 home-operated daycares right now that are currently closed. There was another larger daycare, Christian Co-op, that was closed and just opened as of yesterday. So that's 5 daycares over the past almost 3 weeks that had clusters. And there was 1 hockey tournament that was involved in recreation, and they attended a I think it was down the Cape. Yep, it was down the Cape a couple of weeks ago. And we were able to contact Trace. The coach was very forthcoming with the roster. And again, in collaboration with the school nurses, we were able to keep that intervene rather quickly with that, excuse me. Austin Prep basketball did have a cluster that is not, that has been since resolved. And the only other thing that I would like to state is that we are seeing the number of RSV cases and influenza A we're starting to see as well. And that would be the end of my report, unless anyone has any questions.
Kevin, go ahead.
Hey, Christine, how you doing?
I'm good, thank you.
You must be exhausted.
Yes, yeah, the
Yeah.
cases are going up, and it's I think we are almost at a level where we were last year with the numbers that have been coming in over the past few weeks.
That's what it feels like. So is there any tracking of the cases that we have for breakthrough cases? I have us at
Yes,
189 active.
Yes, so I mean, it's a significant amount of breakthrough cases. If you look at if you look at the percentage, it's over 50% are breakthrough cases. It's more like, let me just, it's more like 63% are breakthrough cases. There's no one particular vaccine, Moderna or Pfizer. What I'm seeing is a lot of cases that were vaccinated earlier on are the ones that are just, having a second infection. I'm also seeing some instances where people have received a booster and are, yeah, I know, not too many just yet, but I'm tracking it as well right now. I would say that in-home transmission, household transmission is the main source of spread of the number of cases, and we are able to link them, but it is definitely, that's the main mode of transmission. And it appears that within the household, there is usually a younger child or someone that has not been vaccinated.
Right.
I can't, I'm sorry.
I was going to say that's pretty consistent. I mean, the state numbers are wildly in that side of it too. I think it's like 90%. If you look at the state numbers, it's in-house transmissions.
Yes, and I can, start reporting those statistics in, future report. I can include that information.
Okay, that'd be great.
Okay.
I just had two other quick things. One is there still a sign up somewhere for tomorrow, or is that fully booked?
You know what? I
Not that
do
the public's
believe
really
there is
watching
some
this right
space
now.
up. Yeah. I do believe that there is some space up available to register, and I can send Mary an email as well, asking.
Okay.
But I do believe that there is some space. Yes.
Okay. So Mary's running, so I can just
Yeah.
You got enough on your plate. I'll communicate with Mary.
Yep, and it's being sponsored by Pelmed, who she has used they have used the school before, and that's been really great. The pharmacist that runs those clinics, she's been really good. She owns the company.
Okay. It's Pelmed, you say?
Yes, it's PELMED. I'm
Okay.
sorry, I'm not sure what it stands for.
That's okay. And the last thing I was just curious about, do you have, are we getting a better buy-in for test and stay than we got last year for the pool testing?
Yes, we are, which I think is good, because I think we're seeing more testing being performed. And I think more of the parents have opted in than they did initially. So I'm glad that the testing was offered again within the schools.
Okay, that's all I got. Thank you very much.
Okay, thank you.
Carrie?
Hey, thank you, Christine. I just one question. Do we have any idea of any severe illness?
So right now there are 2 hospitalizations. I will say that there are about a handful, maybe 10 cases that I'm aware of within the active case count right now that have received antibodies, and they respond quite well, and their symptoms are minimized and they recover quicker. I know that for a lot of older people over 65 that have tested positive, and their symptoms are, they have respiratory symptoms, underlying disease. In some cases, it's been very difficult for the referral for the antibodies. They're not getting as referred as, as maybe some other states. But I think I'm just seeing a switch in it. It seems like over the past maybe week and a half, more people are being offered that as an option to help with symptoms. But right now there are just 2 cases hospitalized. Most symptoms are either mild in younger children and even adults. And I have not had any reported COVID-related pneumonias.
Thank you.
Or secondary infections that might come with.
Carrie?
No, thank you.
Thank you.
Okay.
Hi, Christine. It's Carrie. Hi, everyone. Sorry to join late. It was unavoidable, but here I am, and I'm glad to be here. Christine, thanks for the report, and I'm interested to hear that you're tracking the boosted cases. If I understood you right, you're going to be able to you can share for us in the future information on cases of whether they have received a booster or have been vaccinated or not. Is that what you said to Kevin?
Yes.
That'd be great.
So yep.
Okay. That would be
reporting there.
Go ahead. Sorry.
Oh, that's okay. In Maven reporting, they have been able to, in most instances, download the Massachusetts Immunization Informatics System. So it's able to populate, and you can see if the case has actually been immunized and when. It will give the date and the name of the vaccine. And so that's not always the case, and you do have to log out of Maven and go into the other system. But I would say 90% of the time it's available, readily available.
Okay, that's great, and that would be really helpful information. I appreciate you making the effort to provide us with that.
Okay.
I guess I'm interested to hear about boosted cases. In my world, I'm hearing about hospitalizations that are skewing very much to non-vaccinated people with an occasional vaccinated. And we haven't heard any instances yet of boosted patients being hospitalized. So I guess what we're seeing is that the vaccine is doing its thing. It's, preventing severe illness, if the hospitalizations are more, but we're still not, it's not preventing disease. It's preventing severe illness and death. That was the premise of the vaccination, right?
Yeah.
Okay. Christine, I wanted to ask about contact tracing because I know the CTC wound up operations the other day. I know Reading wasn't using the CTC for tracing per se, but you were doing good meetings with the liaison. And I'm wondering if you have had any, if you have any plans on sort of how to not have that anymore, and if you guys are implementing the suggestions from the state on easing up on contact tracing protocols.
Yes. So I will say that I did meet with Sandra Aronson this week. Our meetings will continue until the end of this month. She did share some pretty great resources that Shuang and I are going to incorporate into the current resources that are provided within the town of Reading, whether that be social resources or psychiatric resources. But we're hoping to, again, like just incorporate something more formal into what, we have readily available. And with regards to contact tracing within the town of Reading, yes, we are just in the talks of that. Again, it's really great that the school nurses are able to intervene, but they are extremely busy themselves. And although they can initially maybe acknowledge the case, there's still follow-up
Yes.
every day or a couple of days. So, and I feel that in order to continue that, there does need to be, some, I guess, the cases remain this high. We are going to have to come up with a plan to who's going to tackle them on, the days that I'm off. And I know that, Shuang is willing to help with that, which is great. And I've had offers, obviously from the senior nurse advocate as well. I do believe that we are going to look into a grant or some shared opportunity with other communities, which would be great if we could do that, some shared resources. But again, I know that this is we're just starting to talk about it.
Okay, that's good to know.
Christine, can I just ask one question and follow up on that? Is there, now that the state isn't backstopping potentially contact tracing, is there a number of active cases that is sort of like the max that we have capacity to do with the resources within the town?
So it's
200?
I
mean, is there a number?
No, I would say, if we hit 200, that would, and I know we're almost there. No, so per town, I would say no. But if you take a look at the whole state, I do know that Maven reporting will not work properly if the towns do not acknowledge in a timely manner. So we're lucky in that right now cases are being acknowledged, within 24 hours. But I've received a part of the Massachusetts Public Health Nurses Association, and there was a lot of back and forth today from other nurses in other towns in what they're going to do, because many other towns have utilized the CTC, and now they're kind of at a position where, one town, a couple towns over, 100 cases today. She's the only nurse, and they're either looking into hiring some per diem or school nursing, or some of them have already been a part of a grant where they're going to start teaming up with other towns for shared resources. But I do know that pretty much there were about 25 public health nurses that were talking just about this today exactly. And so I think everybody's just trying to start to put together a plan.
Thank you.
Just as a follow-up, I met with Shuang and Christine, was it on Monday and Tuesday, to develop a plan to tackle the CTC, excuse me, the CTC issue. We know that by December 7th or 8th, there will be no more CTC. So what we discussed was to have Shuang be a backup, 1. 2, have the school nurses help us out have a monthly meeting with Shuang, Christine, school nurses. I'm also discussing the opportunity of a shared service grant with Reading, Linfield, Methuen. The previous interim director, did not join that coalition, but I'm thinking of joining because we can see that the cases are going up and we're going to need as many hands as we can get. So I'm looking into amending the grant to include the town of Reading, and hopefully we'll be able to get the funding we need and get some of the work off of Strong and Christine and the school nurses. So it's a work in progress, but we're working towards that. And just one more thing regarding the reporting of the cases, the breakthrough cases. I think it's a good idea, but we have to be very cautious because we don't want to send a signal to vacciniers or people, that don't like vaccines. We don't want to give them the comfort that vaccines don't work. So I think we should be very careful and cautious in terms of what we report. The vaccines work. You need to get vaccinated, period. So we don't want to, put out information that may justify people for not getting vaccinated or not getting boosted.
Oh, that's your decision.
Good point. Good point.
Excellent point. Thank you, Ade, for those observations. I'm glad to hear the works in progress, and yes, very good point. Yeah, it's always a little trepidatious about how much info you get, but yes, okay. If I may, I just want to there was just one last thing. I know there was talk about the monoclonal antibodies, and actually in some good news, I think the states announced that they're opening 3 monoclonal antibody clinics. I think opening tomorrow, and one of them is actually going to be at CHA in Everett. So that makes resource a little bit more easily referred for people. So thanks as always for your work, Christine. Thank you.
Thank you.
Thank you. Shuang?
Yes, thank you, Dr. Lopez. And I'm gonna share my doc. Okay, good evening, everyone. I just would like to provide you some updates regarding COVID information, town website updates, the regional emergency preparedness, and the new variant, Omicron. So as of November 23rd, which is last Tuesday, we had the, vaccination rate, fully vaccination rate in town of Reading is 70%, and there are 80% received the first dose. And in the younger age group, 5 to 11 years old, 41% had their first dose. And like Christine said, the school will have another clinic tomorrow. So the percentage of the fully vaccinated in this young group will be, increased. And we recently received many phone calls regarding where people can find to have booster shots. We would recommend the public to, visit Vaccine Finder, which is state website, and you can type in the zip code and find the nearest vaccination site. And some website updates. We had posted healthy holiday season safety tips on the website to, sort of educate the public to, practice preventional strategies to reduce the COVID-19 cases. And we also update the Board of Health frequently asked questions regarding the, if people need to wear a mask and why. And also we have some detailed information regarding the age group 2 to 5 years about the mask and the face covering. I also would like to give you some information about our senior center. So on November 17th, we had one positive case reported by a staff, and the senior center completed the deep clean and they closed the center. They had all other staffs tested for COVID-19. All results come back negative. And on the November 19th, that Friday, Ade and I meet with senior center director and administrator and Jean, our assistant town manager. And we made the decision to close the center until after Thanksgiving. November 29th is Monday, and also notify the clients and the public. So now senior center has reopened this Monday. And a quick updates for the regional emergency preparedness. On November 17th, the HMCC red flag alert system has sent out a web EOC drill. Reading has successfully completed it on time, and our rate for Region 3B is 87.5%. And last, I would like to share with you some news about the Omicron. As you may know, on November 26th, WHO classified the new variant named as Omicron, and it's first reported to the WHO by South Africa. So far, the transmissibility and the severity of Omicron is not quite clear. In the United States, we had the first case of this variant from a returning traveler in California. CDC is currently, recommend some strategies, including wearing masks in public indoor settings, washing hands frequently, physically distancing from others, and getting vaccinated. So let's, continuing practice these prevention strategies and, help to reduce the spread of COVID and the variants. Thank you. Any questions?
That was helpful, Sean. Thank you.
Thanks, Sean.
Thank you.
I have a quick question. Is there anything we can be doing right now to help improve the vaccination rates amongst the elementary schoolers or kids? I know that somebody from economic development, Erin, she informed me earlier today that there is a bookstore, a kids bookstore on Main Street, and she welcomes the idea of having a vaccine bus park in front and pretty much offer vaccines to kids that go in there to buy books, that go in and out. So is there anything we can be doing to improve the vaccination rates among this population?
Can I just this is Christine, if I could just make a comment. A lot of times the cases that I speak to parents of kids that test positive and have younger kids, they do express their worried or their concern. I try to educate one-on-one, but it would be good if we could get an education type message out I'm just not quite sure how to go about that.
If I may. I think if a bus by Whiteland Books, I mean, that's amazing. If they're willing to do that, if there are other, retailers that are interested in, encouraging and supporting folks doing that, I think that's great. I know for education, I just saw a really interesting presentation on the local public health call yesterday of the different resources that the academic public health core has created and can continue to create. So it may be that that's a source, and that we could use some of the nice flyers and communication pieces that they've developed and figure out how to distribute them. I think that would be wonderful. And I don't know. Well, so I guess I don't. Those are all my ideas right now.
Harry, can I jump in on that idea? I think the distribution is at the school, right? Like if you had a pamphlet that you could get into the schools, and they could send them home with the kids, and
Yes,
that's what I do every day. I go through JT's stuff and okay, what's coming home? What information do I have? I'm sure just about every parent in town does the same thing.
Yep.
So I think that's your delivery mechanism.
Yes, perfect. Backpack Express, they used to call it. Yes.
Yeah.
Great idea, Kevin. Yes.
No, just
Yeah, we
piggyback.
can also.
Great idea.
Yeah, we can also.
So would
post
you
it online.
suggest, would you suggest speaking with Mary up at the high school and seeing if there's something that Shuang and I can present there to maybe the parents, or put together even a brief educational flyer to distribute?
So, I mean, yes, and I guess I would just suggest maybe starting with what already exists, because I hate reinventing the wheel, and looking to see what the academic public health core has created. It's free. It's available for use across the state. Anybody that wants to use it, and they may have something that really suits your message. And I do believe too that they'll work with communities to create something new if you need it. I don't know, Shuang, I don't know if this is something you're tuned into with your work with the EP coalition.
Yeah, I mean, that's great idea. I know the academic crop, and they just share the link for those flyers, so it's very easy to find. I can share some with Mary, and we can also post on our website.
I wonder about the parent issue, because I'm looking at the the immunization data that Shuang shared, and ages 12 to 15, 82% have had one shot, 16 to 19 greater than 95%. So these are the same parents that have kids in the 5 to 11 range. I'm not getting the sense that the parents in Reading are shying away from immunization, because the immunization that's been available for ages 12 to 19, they've actually done a pretty good job. I wonder whether for the 5 to 11-year-olds, I don't know whether it's because it's more recent and they just haven't caught up, or it's access. And I was wondering whether the school was planning to do a much more aggressive job in terms of clinics, immunization clinics for this. I mean, I know they've done 2. Well, they've done 1 and they're doing the second one, but that seems like a relatively small amount. Have you talked to Mary about focusing more on-site school vaccine programs for ages 5 to 11?
No, but that is something I will definitely, I can talk to her about. I do know, again, they're focusing on the clinic tomorrow, and I do believe that they may have another clinic following that, but definitely we'll follow up with her on that, on this.
Okay. But I think the educational piece is also important as well. I'm just thinking that there's education, there's access. So.
Yep. 100%. Yep. No, 100%. That's true. It's interesting that there's not a high uptake for the clinics. I mean, if I understood right, there's space still available tomorrow. I just find that interesting, and I wonder why.
Yeah.
Maybe you guys can find out for us.
Okay.
Okay. So moving along, public comment. I don't believe we have any folks who have volunteered to comment. At our next meeting in January, we will be having MAPC come back and give their initial draft findings. So that'll be significant. And then, as Ade said, we will have some pieces around the tobacco violation and also yes, on the and on those. So it should be a robust agenda. And I just wanted to comment, this is Jean's last meeting, and you know, just thank you, Jean, for all your support and contributions to the board, you know, over the last year and a half, at least that I've been associated with it, and I'm sure years before that as well. You know, you've always been a very calm and steady voice, you know, wise counsel based on all your years of experience, and you know, always very helpful and supportive, and you know, I think we've been lucky to have you, and I might say in a good way, we know where to find you if we need you in the future. That's not a threat. But thank you.
Thank you. It's been a pleasure.
Yeah, I'd like to second that. Certainly, Gene and I started on this trail a long time ago, it feels like, Gene, especially the last 2 years. But yeah, I echo everything Rick said. You've been a real asset to have in these meetings, and you know, don't be surprised if you get a text during one of our meetings from me every now and again. Might happen, just saying. But thank you very much.
Anytime. Thank you.
Yeah, and I'm just gonna join in and thank you, Jean. I didn't realize this was your last meeting, so you know, Rick, thank you for letting us know, Rick, and not letting her Jean sneak out without saying goodbye. Thank you. You really, it has been, I have not had nearly the time that Kevin has had with you, or nearly the tight interaction that Rick has had so much, but it has all been a pleasure. I am grateful for everything that you do, your commitment to God getting us through all those minutes and so many things. Very much appreciated. So thank you. And I'm sure you'll miss us.
Yes, I will. But I'll get to watch the recordings, so it won't be far away.
Riveting.
And even though
Thanks,
it's,
everybody. I just want to say a big thank you, and I'm so very pleased that Ade is on board and taking the lead. You know, he and I've had a couple of good meetings, but I'm very happy to just be a resource as needed. And absolutely, anytime I can be helpful on anything, don't hesitate, because that's public service. We're here. So best of luck to everybody.
Thank you.
thank you. And I would also like to thank you as well. Even though I've been here for a short period, you've been a great resource. The transition period has been really great. I like the package you prepared for me when I got here. It made things really easy. You know, I was able to figure out the pending issues, things that I had to focus on short term right away, things that I could, you know, put aside for a little bit. So you've been really helpful. I'd like to thank you for that.
And with that, I'd like to make a motion to adjourn. Do I have a second?
Second,
Second. Roll call. Kevin,
Yes.
Carrie,
yes.
and Rick. Yes. I'm not going to say Happy Easter this time. I'm going to say Happy Holidays.
Happy holidays.
Happy Holidays. Merry
Just
Christmas.
enjoy the holidays, folks.
Yes.
Bye-bye.
We'll see you next year.
Yes.
Bye, everybody.
Happy holidays, everyone.
Good night.
Good night.